in the urine or hematuria. Now, seeing blood in your urine can be alarming. Listen, it can be alarming. Naturally, when you see blood, you panic. You feel that something is definitely wrong in your body. Definitely, yes, something is wrong. You see, nothing just happens. Always the body will give you the signs or the symptoms. But then if you ignore that, then it moves forward. Normally, symptom development is the 5th level of disease development. We have 6 levels of disease development, and level 5 is the symptom and signs. But you see, it's a bit of a shame to wait until the symptoms and signs appear in your body. Well, hematuria is the medical term for blood in your urine in a way. Several different conditions and diseases can cause hematuria, or that is blood in the urine. This can include infection or kidney disease or cancers or rare blood disorders. There could be a rare blood disorders that can be affecting your system and you have no idea that is going on in your body. Any blood in the urine can be a sign that something serious or a problem is coming on the way. I am not trying to scare you at all, but I don't want you to ignore hematuria or blood in the urine, because when you ignore it, it can naturally lead to a worsening serious condition like cancer or kidney disease. Definitely, yes. So hematuria or blood in the urine can be categorized as gross. If something is gross, it means that it's visible to the eye. It means that you can see the blood in your urine, the red color in that urine, or the pale red in your urine. But sometimes you may not see blood at all. By accident, when maybe your health provider asks you to provide your urine for general examination, they may by accident find blood in the urine, and that is called the microscopic one. It's another type. So normally you as an individual, you may see the gross one, the blood, the visible one in your urine. But then we have the microscopic one, which you can see with your naked eye. So you see that many people are wandering around and they have blood in their urine without knowing it at all. But today we will come to understand certain signs and symptoms that can prompt us possibly, and then we can take the necessary steps. All right. Now, when we move on, we can see that there are certain signs and symptoms that we have to talk about the causes and the specific causes, and each cause has their signs and symptoms. Now, let's listen to the first cause and the signs and the symptoms. But before getting to know the cause and the signs and symptoms, please let me put this number on the platform. Maybe you have a different disease. It's not about blood in the urine or hematuria at all. It could be a different form of disease. Please do not hesitate to give me a call, and I'll be very happy to help out, because there's always a solution to our problems. Now, the number is +44 738 464 7300. The number again, +44 738 464 7300. The second number is +44 745 988 9152. This number again, +44 745 988 9152. Now, let's come to the causes and the symptoms, actually. So, now the first cause and their symptoms is the urinary tract infection. Urinary tract infection, this occurs, it happens when bacteria enter your body through the urethra. You see, the urethra is a tube through the through the vagina or through the penis, right? And when bacteria get through that into your bladder, or into that person's bladder, bacteria can multiply in the person's bladder. And so when this happens, these are the following signs or symptoms that the person may experience. The person may have a persistent urge to pass urine or to urinate. You feel like urinating all the time. And as you pass the urine, you also experience burning sensation or pain. And then the urine may also have foul smell, or may have a strong smelly, strong smell. So you know what your urine is. So when you have a situation that you persistently pass urine, and there's a pain or there's a burning sensation while you're passing the urine, and there's a foul smell or your urine is smelly, you have to understand that something is wrong with your bladder or your urinary tract. And so the urinary tract infection can also lead to blood in the urine. So we see this is something that you can reverse. It's not something that you should be afraid of. So when you see blood in the urine, it's not the end of your life. It's not the end. So it could be urinary tract infection, listeners. When we move on, the next cause and the sign is the kidney infections. These can occur when the bacteria also enter your kidneys from your blood, and then it moves through the ureters. The ureters are the tubes connected to your kidneys, and it connects your the tube from your kidneys to your bladder. We call them ureters. And so when bacteria gets into your kidneys through your blood and infects your kidney this way, you may also have the same symptoms as a urinary tract infection. You may have a persistent urge to urinate, to pass urine. There's a burning sensation or pain, and there's also foul smell. And you see, once again here, it's not something that should kill you. You can also reverse this problem immediately within just few weeks. Or few days. You can, not antibiotics. You shouldn't take antibiotics because antibiotics is going to damage your kidneys. It is going to also bring down your immune system. You have to remember that. So the signs here are clear, but we can reverse it naturally. It's very simple. Another cause is a bladder or kidney stone. Bladder or kidney stone. Normally, the minerals can concentrate in your urine, and when they concentrate in your urine, in the bladder, it can then get on the walls of the bladder or on the walls of the kidney of your kidneys. And when they concentrate over time, these crystals or these small stones can become very small and hard stones. And these stones are generally painless. You may feel no pain. So you wouldn't know that you have them unless they cause blockade, or when you are passing urine, then of course you may have some pain, and the symptoms of this can be very, very painful. Normally, you may feel pain on one side of your body that is above your waistline, about 10 centimeters above your waistline inside. That's where you have the kidneys. So if you have pain above your waistline within the body, then it means that you may have some small stones either in your kidneys or in your bladder. And this can also lead to can lead to blood in the urine. So we shouldn't forget it. But this can be reversed. You could break these stones. You could break these stones and flush them out of your kidneys naturally. So you shouldn't take anything. You shouldn't go for operation. This is not operation situation. So you see, it's not any blood in the urine that is the end of your life. No, it's not. That's why I said knowledge is everything you need. Once you have the knowledge, you know what is happening. Now, the next cause of blood in the urine is enlarged prostate or prostatitis. That is inflammation of the prostate. Well, women don't have prostate, so you shouldn't be bothered. But as you listen to me as a woman, you share that with your husband. If you're a man, of course, you're listening for yourself. And naturally, men get into around 40 plus, or getting or mid 40s, some men, not all men, should have prostate enlargement. What is the prostate at all? The prostate gland is just a muscle, a sort of a gland just at the neck of the bladder. And when it's getting enlarged, it squeezes the neck of the bladder. And that's where we have the urethra. The urethra is the tube. It goes through the penis, right? And so at the neck of the bladder, when the prostate is a bit enlarged, it squeezes that. So it narrows the urethra. So in this case, when the amount of urine that should go through from your bladder, it may not go through. So some amount of urine may remain in your bladder. So a little while, there's a pressure that develops in your bladder to prompt you in your brain that you should pass urine again. So that's why those individuals, of course, men with prostate enlargement, have persistent or frequent urination in the night and day. When you sleep in the night, a man, you should have either zero urine, that is from night till day, 6 a.m., or only once, either 0 or once. So if you pass urine like 3-4 times, know that it is abnormal. Know that something has started, and you shouldn't ignore it at all. So prostatitis is very similar to prostate enlargement. It's simply inflammation of the prostate gland. And then you can reverse all these conditions. And remember, if you are a man and you are listening to me, prostate enlargement is not something that you should undergo the knife or operation. If you do, you're going to kill yourself sexually. You'll be dead. Secondly, you may have what is called the stool and the urinary incontinence. It means that when even you feel urine, you will not feel it at all. You may not feel it at all. And the same thing with stool. And so that individual may just do it on himself. So the person may need diapers, or Pampers. And that is a real problem. Well, as we go on, we can also see another cause too. That is kidney disease. Kidney disease is something that also can affect or can lead to blood in the urine. We have the filtration system in the kidneys. There are tiny microscopic tubules in the kidney. There are about 1 million of them. And those tubules can be inflamed, and then when they are inflamed, they can also lead to blood in the urine as well. So when you have blood in the urine, it can indicate kidney disease, which you shouldn't actually ignore. But the good news is that if you have this particular or any other thing I have mentioned, 100% you can reverse this condition. They are not conditions that is the end of your life. No, you can, by God's grace, reverse them naturally. When we move on, we can see a more serious condition, that is cancer. If the bleeding is so visible, is really dark or a red, very red blood with clots in your urine, then it can be quite serious. It could be advanced kidney or bladder or prostate cancer. It could be that. So you cannot ignore that. Unfortunately, you might not have symptoms or signs at the early stages when these cancers are really treatable. You can reverse them. But then if you ignore them and you don't have the right person to help you out, then of course it can move on and it can be a rare problem. Another thing is the inherited disorders. Now, if we say inherited disorders, a typical example of inherited disorders is sickle cell anemia. Sickle cell anemia, is simply that individual red blood cells. The lifespan of the red blood cell is only 10, 12 days. And then the shape of the red blood cell is not like normal. So they cannot carry enough oxygen around, and the lifespan is just 10, 12 days. So through this health condition, there could be also blood in the urine as well. So the sickle cell anemia, this is an inherited disorder, can cause this problem. And then another cause can be kidney injury. Kidney injury, when there is a blow or an injury to the kidney or a tremor, a form of accident or through sports, and there's a trauma on the kidney side, this can also cause blood, or it can lead to blood in the urine as well. Another cause is medication. Normally, medications like antibiotics, can also cause injuries to the kidneys, and it can also cause kidney weakening of the kidneys. Painkillers don't only kill the pain, but also kills your kidneys as well. It kills the liver, it kills the heart, it kills your gastric system. So painkillers can also cause injuries also to the kidneys and lead to blood in the urine as well. Now, strenuous exercises. Some individuals may exercise strenuously, strongly. If you do too much exercise, too strongly, it can also cause this problem. Possibly it could affect the bladder, or it could affect your kidneys in a way, or indirectly, and it can lead to this problem. So that's why it's really important to do exercise in moderation, not strongly, because too much exercise and too strong exercise can be damaging, and it may not be helpful at all. Menstruation, of course, naturally can lead to that. This is less common, it's less serious problem. But then another funny and also less serious cause is sexual activity. If the man is too aggressive, possibly there's no foreplay, and jumps into action, no foreplay, and the woman is not prepared, it can cause some sort of internal injury, some little bit tear somewhere, and it can also lead to that. And so this is a less serious problem, and so that shouldn't be a problem at all. But then, of course, it's only advise the man how to approach this whole thing. It's not a war time. It's something that we should really take it, slowly and with caution. Now, polycystic kidney disease is also a condition that can also lead to this problem. Polycystic kidney disease normally affects women. And the primary cause of polycystic kidney disease is the hormonal imbalance. So if a woman has a hormonal imbalance, normally it can lead to polycystic kidney disease. And that is also a risk factor for this blood in the urine. When we move on, we can also see that the complications. What are the complications of hematuria or blood in the urine? Some of the complications are the following here. Normally, we can't ignore anything that we see or your body gives you, the signs and symptoms that your body will give you. Unfortunately, the signs and symptoms are they are the fifth level of disease development, the signs and symptoms of any disease. So when you see any early sign, you should try not to ignore, but to tackle it immediately. Report it to your doctor. You can give me a call, and then we can find a way forward immediately. But then if you ignore that, then it means this could lead to possibly advanced stage of cancer problems or kidney failure, or more serious problems like the prostate cancers. It can lead to that, more advanced stages of that. Now, who can get these problems? I'm talking about blood in the urine. Who actually have the risk factors? Now, men, number one, men that are in their 40s, 50s, I'm talking about prostate enlargement. Women don't have prostate. So, of course, if you're a man and you are getting to your maybe mid-40s or around 40, it can happen that your prostate may be getting enlarged, but it's not any man that should have prostate enlargement. If you cleanse your body, you provide your body with the right nutrients. You see, normally the prostate needs zinc, it needs selenium. Zinc, selenium is so important. Not go and take artificial zinc and selenium and vitamin C. No, there are certain food, certain nutrients that you take for your body. That's what the prostate actually wants. So every organ in the body requires specific nutrients. So when you give these organs the right nutrients and you cleanse the body and there's a good blood flow, circulation to that organ, you will never experience prostate enlargement. Never. So not every man should experience that. Now, the next risk factor is the infections of the kidney and bladder. If you have frequent infections of bladder, especially women, because of the position of the vagina and the anus, it can be a frequent one sometimes among certain women. So frequent infections of the bladder and the kidney can also lead to this problem. And so when you have any sign, you should take the right step. You see, family history is not an issue at all. It's normally 3 to 5% of any disease development. It's only up to that individual. If you live healthy life, that genetic will lie low in your body and it will never trigger. It will never be, no disease will affect you because your parents had it or your grandparents had it, so you should have it. And it's only 3-5% of every disease in the world. Remember that. And as I said, certain medications like aspirin, non-steroidal anti-inflammatory pain reliefs, like the ibuprofen and so on, and antibiotics, they cause these problems as well. So, today, listeners, lovely listeners, what is the takeaway home? What is the takeaway home? We've got to know that, blood in the urine is not the end of your life. It's not the end. It may not be cancer at all. It may not be any form of cancer. It may not be prostate or bladder cancer or any cancer at all. It could be some form of infections affecting your bladder, or maybe the prostate is inflamed. It could be that, or it could be kidney stones, which you can reverse. And we've learned that it could be strong, even sexual act can even cause that. Polycystic kidney disease can also even cause that. So when you see blood in the urine, you should know that it's not the end of your life. That's why knowledge is so powerful. And I'm so glad today you tune in to support this program. You can share this link and others to visit our YouTube. Please like us there. Subscribe. When you subscribe, you will never miss any presentation. You will always receive them when we present them. Just subscribe, please, and like us and share so that people will get empowered, through knowledge, because knowledge is everything we need, lovely listeners. And I know, just go to our YouTube, it's Dr. James Natural Link. Once again, Dr. James Natural Link. You go there. Also, Facebook is the same, Dr. James Natural Link. Just go and then share, please. And then God will richly bless you. You'll see that your life will never be the same. Thank you very much, lovely listener, for tuning in. On Sunday, we have fresh topic for you. Every Thursday, Sunday, we don't repeat topics at all. God richly bless you. And I will be in touch with you on Sunday, God willing. Goodbye for now. God bless you.